I'm going to be citing various external sources today, and in the key cases, I'm going to put the links at the bottom. One of those is it's a consulting organization, LEK. They've been conducting a weekly survey of 100 hospitals for the last 9 weeks. It takes them a week or two to compile the data, so this is their most recent results for basically the last week of May. The orange diamond that you see is how people responded the last week of March. So at the end of March, what were hospitals concerned with? Number 1, PPE supply. Number 2, staff wellness. Number 3, ventilator supply. 2 months later, notice where the bars are. It's about the economic impact. The number 1 concern of hospitals, hospital finances. Number 2 concern, reduction in elective procedures because it drives hospital finances. Most of the concern around PPE supply and staff wellness is now centered around concerns about second and third waves of infection. Here's the good news. We can, to some level, control our hospital finances. We can't make people want elective procedures, but we can understand with all those financial constraints, how are we going to continue offering good quality of care? If you want to know how bad is the reduction in scheduled and elective procedures, for the last week of May, elective procedures are down across all hospital groups an average of 40%. People are treating with medication or they're just not seeking treatment, which leads to an estimate of additional deaths, this is according to Revive Health, additional deaths from not going to the hospital of approximately 43,000 additional people will die this year. So it's not just about revenue, it's about people not getting the adequate control they need. And how do we communicate that out? How can we have people come in when it actually makes sense to do so? And that's one of those things we can control. We can understand what our risks are and we can mitigate them. So while a lot of hospitals, particularly historically in the Northeast, although now it's spreading, Arizona is seeing some surges, there's some other regional surges right now. While a lot of hospitals have had full or overcrowded emergency rooms and ICUs, those same hospitals have been directed in a lot of cases by the government to forego those elective surgeries, which impacts cash flow, obviously raises concern over capital. The government understands the impact of all this. Part of the government bailout included a large amount of money for hospital providers. So far, they've distributed, at last check, $72 billion for that, but it's still affecting our liquidity. So there are 3 things, this is according to CFO.com, there are 3 things we need to get a handle on before it's too late to do anything about them. 1, we have to understand the liquidity of our organization. Some hospitals are already understanding that, and that's why they had to do things like reduce staff costs and furlough people. I know it seems crazy to the outside world that we are having to reduce our number of people supporting the hospitals and having to reduce staff pay. Change in what's happening with our mix right now. So company liquidity is about how much money I have, how much access do I have to it, when will it run out. Also supply chain, there are still some concerns about this, particularly in organizations that have single points of failure. One of the questions we had up at the beginning was, how do you think that COVID-19 is going to affect your industry long term? And there was an excellent response. We think a lot of this is going to be sourced more locally. Right now, a huge portion, particularly our pharmaceutical manufacturing and some level of the PPE, is produced in China. So when China shut down, it not only stopped things like face masks, it also reduced some of the pharmaceutical distribution. And a lot of that's going to have to move locally. So for instance, in the United States, a lot of it's going to have to move back to the US. But we have to have multiple options for if our supply chain is interrupted. We also are going to have to go from the kind of just-in-time inventory, assuming whenever we need something, it's going to arrive, to either us having a stockpile or suppliers having a stockpile. In company guidance, we have to have open conversations with our investors, our shareholders, our lenders. So whether we're for-profit or non-profit, they have to understand what we're expecting. Wall Street and banks hate uncertainty. What happened yesterday was uncertainty. They weren't sure about something, and we're going to get to that one in a little bit, so they had to price it into the price of the stocks. If they take whatever they think the stock is worth or your organization is worth, and then they take whatever risk and they subtract that off the value of your organization. So the less you tell them, the more they have to assume bad things, the more that risk is going to go down. In terms of liquidity, key advice, we can't look at the current month. We have to be looking ahead, at least at the next 1 to 2 quarters. What is that demand going to look like for our organization? When are we going to see people start to come back in for scheduled elective procedures? Are customers going to delay payments? of that LEK survey that I gave you the link for, one of the things it talks about is what we're seeing with days sales outstanding, basically the payments coming in from people, not just the insurance companies, but the portion where people are doing elective and paying a larger portion out of pocket. What is that delay looking like? Are we going to have issues with providing all of our services? What is going to happen to our revenue? How can we control our expenses? 3 bits of advice, and you're doubtless all doing these. 1, it's a priority about how money is going to be spent. Number 2, and we're seeing this, ask your vendors for help getting through the cash flow crunch. We do a lot in the healthcare space, which is why we're able to put on today's provider conference. We were contacted by some of our healthcare providers saying, is it possible you could delay your payments? And we are doing great liquidity-wise and said, yes, absolutely. We understand you need us now. And just like we want you to be a great customer, we want to be a great partner with you. So just like you would reach out to Interel and say, can you help us through this cash flow crunch? All of your suppliers, all of your vendors should be able to do that as well. And also, especially at the large chains, but small chains are doing it as well, even single hospitals. They're going to those insurance on the provider side and saying, can we get additional funding, increased funding, a change in funding? Supply chain was one of those things that we always had providing goods to us within the healthcare provider space. We didn't understand how it would be impacted by unexpected disruptions so immediately. We started seeing delays, disruptions in receiving materials from all of our suppliers that led us to not providing the care that we wanted to, the quality of care, to all of our patients within our organizations because we just didn't have the product in a lot of cases. So what's happening now is we are understanding that even if the costs are increased, in a lot of cases, there is some level of being able to pass that on, but even where it can't, we have to have local supply chain sources. We have to have regional supply chain sources. To whoever said it at the beginning, and you were completely correct, we have to be able to get things without having to go through multiple countries to arrive. Understanding that during times when everything is calm, we can go and get it from the cheapest supplier or the largest vendor that's out there, but we have to have that diversified supply chain or guarantees, and I'll cover that one in a second. We have to have digital health options. This is one of those acceleration of telehealth. There have been a lot of reasons why it hasn't happened up to this point. Some of it from the medical provider side, a lot of doctors' organizations have been feeling that you just can't provide good quality of care through telehealth. Also on the payer side, with the people that are actually paying for the insurance reimbursement rates, in a lot of cases there are different reimbursement rates on telehealth, telemedicine, and that's got to change. We also have to have transparency. It's one of those things where we didn't understand some of the levels that were happening. So we might think, oh, we have a local supplier. They can provide us everything we need. Now realizing that even though they might be based down the street, they're actually getting their goods from Southeast Asia somewhere. So we have to have analytics into where everything is in that entire pipeline. One of the things that you'll notice is if you ask, you will see a decrease. 80% of hospitals are getting some price concessions, or at least asking for those price concessions from their suppliers. In some cases, this is in goods, actual physical things being provided. In some cases, it's services, where they're saying, we really need your help right now. As a good partner, we can get back to your normal rates at some point in the future, but can you take a discount? Can you do some level of price concessions to help us out? We are also demanding those supply guarantees. We're demanding more flexible payment terms from all those vendors that are providing to us. Long term, we don't see that we are going to have a different mix of suppliers. We understand we are going to require greater things from those suppliers. So we are going to require greater levels of contractual agreements. And we are probably also going to be using manufacturers that can offer a wider portfolio of products, even if right now we're getting, for instance, all of our ventilator supplies from one supplier and all of our face mask supplies from another supplier. If they potentially overlap, we know we have additional options. So the biggest thing that we're seeing right now, this again is from another aspect of that LEK survey, is minimum we are getting supply guarantees. And a supply guarantee is not, you will give us something within 5 days or we can drop you as a vendor. It's, you guarantee you have a stockpile. You guarantee that to meet that service level requirement when we ask for something, you will not then immediately request it from your vendor. that you will have some level of inventory that they're actually storing around. So the two biggest things happening right now, we're getting those guarantees, and about a third of us are actually getting flexible or extended payment terms. MD&A stands for Management Discussion and Analysis. The key thing to realize about MD&A, it's not just backwards looking, it's guidance about the future as well. Shareholders, potential investors, they rely heavily on earnings releases and guidance when making investment decisions. The recent market volatility demonstrates a whole lot of investor uncertainty regarding the severity, duration, and possible multiple waves of coronavirus. In light of this fast evolving situation, you actually have to give more guidance, not less. As I said earlier, Wall Street will pummel your stock if you don't give them guidance that things are going to be okay. Or if things are not going to be okay, if you tell them that, they'll price it in immediately, and you'll not see the massive swings in volatility when they think they've uncovered something about your industry or about your organization. According to an article that came out in the Boston Business Journal, there are 7 predictions on how the epidemic will change healthcare long term. And some of these were actually suggested by all of you at the beginning. Number 1, telemedicine is here to stay. There's a good quote I saw last week from UnitedHealth. I'll show you in a second. Second, deferred health costs. We are going to see people delaying elective procedures, not taking them on the second that they think, oh, yeah, I might need a knee replacement, I should go do it. We're going to see people pushing those out until the economy stabilizes, because people don't want to engage in elective procedures if they think they might need that money. We're going to see more costs being reimbursed from governmental programs. We're going to see coverage being expanded in certain areas due to gaps in critical coverage. The government is going to get more and more involved. They're already telling us what procedures we're allowed to do, what things they deem are essential, and how we have to devote our organization to looking like this and not looking like that. We are going to have to really refocus on claims control and what that reimbursement strategy is going to look like. Then we're going to have to reponder long-term care. What does that actually mean if we shift some of that long-term health care from being inside of our hospital, inside of our clinic, inside of essentially inpatient, to being much more of an outpatient stay-at-home? It was just a little over a week ago, UnitedHealth executive said about telehealth and reimbursement, the genie is out of the bottle. Telehealth, it's here to stay. How does that affect hospitals? For the first time ever, ear and mouth diagnoses have risen into the top 5 uses of telemedicine. Telemedicine is not a brand new thing. People use it for, oh, I think I might have the flu, can you tell me? Hey, I really like a prescription for this. They hop on telehealth and a doctor from the middle of nowhere will say, yep, sounds good to me, go off and get it. We weren't seeing things like a doctor visit for ear and mouth. It just wasn't even in the top 5 at all. But that's one of the biggest shifts, is for oral diagnoses. We're actually seeing people actually be able to do it through telehealth and not have to go in. Getting back to one of those things we can't control, but it concerns us a lot, is virus spread. We're all concerned about the spread of the virus, both globally and regionally. We can't personally change that. There are outbreaks and increases that are happening. In Texas, we just hit our highest single day confirmed number of daily cases. I think it was yesterday. California is at their highest running 7-day total for hospitalizations, which in my opinion is a much better indicator. Without getting off on a tangent, case count really is affected by testing. If you look at why Iran had such low numbers, or India had pitifully low numbers. I think there were more cases in the city of Dallas than there were in all of India a month ago. And it was due to lack of testing. I think hospitalizations are a much better indicator. And that's why it's so concerning. And that's a lot of what happened yesterday to the stock market, is we started seeing these increases in Texas and California and Arizona and the Carolinas and elsewhere, which leads to concern about that second wave. There are a couple of different ways it could happen. We could be in the almost sine curve method, the peak valley, peak valley, peak valley kind of method. There is also concern about maybe a small second wave now, but a massive peaking in the fall as we basically turn everything back on. The current belief is that this is not going to be a seasonal thing, but there are certain things that we do seasonally. For instance, going back to school. So what might that look like if we have outbreaks inside of schools? And keep in mind that there's been a trend over the last few years to cram as many students into a classroom as possible. So when there just is no room to socially distance. So if we send everybody back, what might that look like? What might it look like as we stop being outside and start coming in? And then there's just the prolonged, never-ending situation where it just goes on and on at kind of this slope and level, and it becomes a fact of life. The key thing for us is we can't change this. We can't personally stop multiple waves from happening. Trust me, many people have tried to tell us how to live. And I was looking out my window yesterday at the park across the street, and I saw a whole lot of people and didn't see a single face mask out there. I can't walk out and go, you people are not socially distancing, you need to put masks on. But what we can do is we can analyze that information. We can change what we do with that disease spread information. We can visualize it. We can incorporate our own information. McKinsey said that if you're looking to develop a skill set, one of the skills that will help companies navigate that new normal is analytics. It's the power to take information and do something with it. I do an entire presentation I'm not going to go into right now on 5 data analyzing tools that you need in times of change. Basically 5 things you need to do to take information and make sure actions actually happen. One of those is scenario planning. What scenarios are possible? How are we going to deal with it if it occurs? I'll dive into that one for a little bit in a second. Second is strategic modeling. What should my strategic plan look like? Number 3, profitability and cost management. What are my most profitable, my least profitable products, locations, services? I won't tell you who it was, but it was actually for a nonprofit. We did profitability down to the surgery level. And the reason was they were trying to find out where their pricing was coming from, whether it actually made sense. Because they're a nonprofit, but they know that if they price things below the cost, or if there are certain things they could be pricing higher, if they really understand the true cost, they can take that information and they can use it to help other areas, basically increase the number of people that they care for. So don't think about profitability and cost management as just in the for-profit space. It's very, very valuable in the nonprofit space as well. Data visualization, getting the big picture about where everybody is at the moment, and then narrative reporting, where we can actually give some context to all of our data. Every one of these things, whether it's scenario planning, strategic modeling, profitability, data visualization, especially narrative reporting, they need to drive actions. They need to say if A situation occurs, B actions will help us deal with it. And that's one of those things we can control. We know that this is disrupting all of our organizations. So we have to ask ourselves, how can we minimize the risks of those disruptions? How we can capitalize on some of those changes? 3 months ago, I surveyed 114 companies, not just in healthcare, but across the board, on what their organization was doing in terms of dealing with COVID-19. If it want to make you feel better, at the time, most companies finally realized our kindergarten teacher was right. We should wash our hands more often. Companies were also starting to limit travel. They're beginning to think about remote work. So what I did is I color-coded items related to slowing disease transmission. Those are all blue. So good news, March 9th through 11th, we had 90% of companies that were doing at least something related to trying to control disease transmission. Things related to finance, meaning under finance's control as red. Items that were more related to controlling spending, I allocated those as purple. There are definitely financial activities, but they're not things that happen entirely in the finance department. Finance can't declare there to be a hiring freeze. Now, on March 9th, so keep in mind, on March 11th, that was the day the WHO declared this to be a pandemic. Let's not get into a discussion about how late the WHO tends to be with announcing things. So March 11th, they said it was a global pandemic. At the time, the highest thing FP&A was doing was at number 5, and it was only done at a third of companies, and that was scenario planning. Now jump ahead to the end of March, start of April. Discretionary spending limits jumped up a full couple of spots. 80% of companies had discretionary spending limits put in place. This is across the board. Also notice profitability. We now have profitability analytics being done at over half of organizations. Shareholder guidance went from 22% of companies to 37% of companies. In a 3-week period, that's a more than 50% increase in companies providing guidance to their investors. This is just a better conversation with your bankers, better conversation with your lenders, better than we're just retracting our prior guidance. So let's talk about guidance for a little bit. We can't make people go into the hospital. Matter of fact, there were a lot of people that said we needed a shelter in place to get beyond what was a pretty heavy flu season, actually, get beyond that so that we wouldn't overtax our hospital demand. As a general rule, unless we can convince the whole government to tell everybody to stay home, we can't change demand for our services, but we need to plan for it. We need to be able to react in real time. We need to understand what those changes are so we can capitalize on them. Yesterday, the stock market dropped at rates not seen since the first half of March. Dow alone fell, I think it was 1,861 points yesterday. It was rebounding for a little bit this morning. So if you stop paying attention to the news about an hour and 15 minutes ago, good job, because it was looking really good at the moment. And that's when I took this snapshot. Most of you know this, but for those of you that don't invest a lot, there are various industry-specific, what are called ETFs, exchange-traded funds, and they're basically baskets of stocks in a given industry. It's a pretty good approximation of how the market feels about a given sector. So while all the stocks got pummeled yesterday, the healthcare provider space, that's the red line, was one of the worst hit. The blue line is the S&P 500. So you notice healthcare was pretty neck and neck, in some periods actually slightly over in the last 30 days of the S&P, and then came the last week, particularly yesterday. It fell much more. Why? Because without getting into it, there were two reasons the market caved yesterday. One of those two was that the market somehow suddenly realized a second wave was probably going to happen, and it was going to hit healthcare providers more than many other industries. Now, this is as of 45 minutes ago. So this is as of 11:15 a.m. Eastern. In the market, this is what's called a, forgive the term, it's not my term, a dead cat bounce. Which is a plummet followed by bargain hunting, causing an increase, followed by scared investors selling off again. So if you stopped looking at the market about 45 minutes ago, you went, oh, it's all reversing. It was just a momentary bit of risk. It wasn't. The market needed a correction, around a 5 to 10% correction, because frankly, NASDAQ was actually hitting record highs. S&P and the Dow were close to within 5% or so of hitting record highs. That wasn't taking risk into account. What they weren't really appreciating was the decrease in demand. And when people started going back out again, we still hadn't done a full level of testing. We still had hospitalizations increasing. We were seeing admissions decreasing. We were seeing admissions in terms of surgical were decreasing. So good news, if you will, there is capacity for hospital beds. That's not a big concern in most areas anymore. But think about it. According to Medicare, surgical admissions bring in half of hospital revenue. Hospitals earn $700 more on average, $700 more on elective admissions than on people coming in through emergency department. 35 states and the District of Columbia actually told their hospitals, this is 2 months ago, to start limiting elective procedures. 27% of patients then ended up delaying or canceling their procedures. There are actually some organizations that have gone bankrupt due to the impact. Most people, though, said we're putting it on hold until something improves going forward. If you actually look at large hospitals versus small hospitals, it's even worse. If you get into the small chains, the rural hospitals, 79% of their volume and revenue in the rural hospitals comes from elective procedures. What we're looking at right now is that roughly a quarter of those, they were not terribly financially stable to begin with, but of their 453 rural hospitals that are classified as that, roughly a quarter of those are vulnerable to closure. This is a report from Fair Health. I made it a very easy URL because I really recommend you read this article. It's based on analysis of private claims to insurance companies. They analyze several billion insurance claims. So talk about something you can do with big data. And it had to do with visits and admissions. So nationally, from March 19th to March of 2019 to March of 2020, utilization of professional services decreased 65%. Professional revenue based on total estimated allowed amounts decreased 45%. From April of last year to April of this year, utilization fell 68%, revenue fell 48%. It was even worse in the Northeast. In the Northeast, utilization in April fell 80%. Revenue fell 79%. All of you are experiencing this right now, but just to let you know, the claims bear it out. Oral surgery had the largest decrease. March of 2020, oral surgery decreased 80%, which is why I think some people were going over to telehealth diagnoses of ear and mouth. Revenue from oral surgery fell 84% in March. If you're curious, gastroenterology was second of the major categories they studied. Were there some areas that didn't decrease? No, there was decrease across the board, but the smallest decrease was actually in pediatric primary care. March, they went down about 52%, and revenue actually only decreased 32%. April, pediatric primary went down 58% utilization, and revenue down about 35%. So everybody was hit, and we can't change that. We can't control it. What we can do is we can understand more about what these economic hits are going to look like. So I'm going to give you a refresher on recessions, and some are calling this the coronavirus recession. It happened so quickly, some are calling it the flash recession. There are still some who are predicting it will turn into the Great Depression 2.0. It will not. I'm just calling it right now. It might be a prolonged contraction, and we'll talk about that, but it is not going to be an L-shaped recession. What happened during the Great Depression was basically a readjusting of how the markets worked. That is not going to occur in this case. But I'm absolutely positive it's going to be one of these things. There's a lot of uncertainty to plan for right now. There are a lot of terms, a lot of scenarios being tossed around. And we have to ask ourselves which ones make the most sense. Which of these scenarios should we actually plan for in a world where everything is up in the air? Clearly, we don't have time to plan for 20 massive potential scenarios. We don't have time to cover all of them, so I'm going to hit the big ones. For the United States, this is a graph of the change to per capita GDP from 1977 to 2019. Why 1977? Because it lets us see something at the start of the 1980s that I'm going to highlight in a little bit. The gray areas are US recessions, and to be clear, we are in one right now. We saw a GDP drop in Q1. We are going to see a GDP drop in Q2. Don't listen to what the economists say as a general rule. The economy consensus for the last job reports was a 7 million additional decrease, and they missed it by 9.5 million because we actually increased by 2.5 million. And you'd think people who do their job studying this for a living would be able to predict a jobs report a little bit more accurately than that. Part of the problem is they're assuming that prior performance is the best indicator of future results. They were going based on what they were seeing, not understand the impact of things like PPP, government intervention, Fed intervention. So that immediately got priced back in, so that's why the stock market went back up. So we're going to talk about those gray areas, plus the gray area that's going to come, the current recession. We're going to talk about this one because it's the one that's going to happen, probably. A V-shaped recession. This is the most common type of recession. Normally there's a triggering event and then it passes and then the economy gets back to growing. In 1990, for instance, we had an oil price shock that reduced consumer and corporate spending, combined with a weakened economy due to some Federal Reserve actions that were designed to combat inflation. They were very concerned with inflation at the time. We had a drop followed by a rise. Good news about V-recessions, they tend to be short. That one lasted 8 months. In 2001, 2002, we had a greater recession, not a great recession, but a greater recession. It was partly caused by consumer spending fears related to 9/11, combined with the dot-com bubble bursting. It was a bigger dip in growth, but still essentially a V-shaped recovery. Some people go, it looks like a distorted W. It's not, just round it off. It's a V-shaped recovery. But we'll talk about W-shaped recessions. A W-shaped recovery is essentially a drop and a rise that makes us think we got over it, and then another drop and a rise. Some economists view these as actually two separate V-shaped recessions. It's because of how economists define recessions. 2 or more quarters of declining GDP. So by default, any growth in the middle isn't a recession. So you can't have a W-shaped recession, except it is, because you're still dealing with ramifications of what caused that recession. There was actually a W-shaped recession in the early 80s. We had a recession. We came out of it quickly. The Federal Reserve started worrying we were coming out too quickly, so they raised interest rates, which dropped us into an even worse recession than we started in, which goes to show that even though I'm fairly positive about recent government interventions, particularly stimulus to the economy, sometimes the government can make things worse. And both of the recession, the W recession then plus the one I mentioned earlier, were actually made worse by the Federal Reserve. A U-shaped recession is a steep drop and then a slow rise. So you might think the 2008, 2009 financial crisis was a V-shaped recession, but that wasn't the whole story of the Great Recession. If you drill into it and look at GDP per capita, you're going to see a drop from 2008 to 2009, followed by years of recovery. U-shaped recessions tend to look more like bathtubs. Some people say swimming pools, as you go from jumping off the deep end to slowly kind of walking back out to the shallow end. Let's talk about the rarely seen and hopefully extinct L-shaped recession, the saber-toothed tiger of recessions. There have been a few L-shaped recessions in the last 100 years. Generally, an L-shaped recession is a rapid drop followed by a correction to how the markets function. It's essentially a structural correction. One happened in Japan only 30 years ago. Back in the 80s, the Japanese were on this path towards global domination. And then their asset bubble burst around 1990, and it led to basically minimal growth, under 1% for the entire 90s. We also saw this more recently in Greece from 2007 to 2016. Like Japan, it was a decade-long correction to how their market functioned. So have we ever seen an L-shaped recession? Yes, we have. It was the Great Depression. In 1925, T.S. Eliot said in his poem, The Hollow Men, "This is the way the world ends, not with a bang, but with a whimper." Call the guy a prophet, because 4 years after that, we got to have our very own L-shaped recession. In October 29, the U.S. stock market collapsed. There's no other way to put it. It caused reverberations around the world. Unemployment in the U.S. hit 23%, and in some countries, unemployment went from the ripples as high as 33%. It took more than a decade to get back to where we were. We didn't get our unemployment back under 10% until World War II in 1941, when we entered World War II. Now, supposedly this recession is what they call it an L-shaped recession. I have to say it looks more like a check mark to me, and we'll get to a reverse check mark in a second. There's a great article, and I've cited this multiple times, in hbr.org. Go out there, hbr.org, search for what coronavirus could mean for the global economy. This article came out on March 5th, 2020, and talk about profits, they called this thing. Since the Industrial Revolution, the granddaddy of all pandemics was the 1918 Spanish flu. Earth had 1.5 billion people, and a third of those, 500 million people, caught Spanish flu. What happened was we dropped rather rapidly, and then we came out of it rather rapidly. Go ahead to 1958, the H2N2, called at the time the Asian flu. 100,000 dead in the US alone. And keep in mind, there were half as many people in the US then. So there were 200,000 deaths now. But notice, steep V-shaped drop, steep V-shaped recovery. 10 years later, H3N2, the Hong Kong flu. Poor Asia gets blamed a lot lately. And again, 100,000 US deaths. And while the change in growth rate did suffer, barely a blip on global GDP. 21st century, SARS. Decrease in growth, but then even faster coming out of it. Some people consider that to be like a heart monitor. But in all those cases, you'll notice rapid drop in GDP growth for 1 to 4 quarters, followed by a rapid increase in GDP growth for 1 to 4 quarters. So the question is not, is there going to be a recession? There is. But how are we going to weather that storm? How are we going to be prepared for the recovery that follows, and who is it going to impact first? So I surveyed a bunch of companies 2 months ago, and the overall average was that there would be 3 potential scenarios. Quick recovery, that's the red curve. Delayed recovery, that's the blue curve. Prolonged contraction, that's the green curve. Both the red and blue curves are V-shaped recessions. It's just a matter of how many quarters we go down and how many quarters it takes to go back up. The green curve, the prolonged contraction, is more of a U-shaped recession, which is a couple of quarters of decrease, bottoming out, and then a slow rise. So economists are now inventing terms to talk about the shape of this recovery. In the last week, I've heard the dead cat recovery. I've heard a flipped tick mark recovery, which is basically that check mark, but flipped. I've heard the square root recession, which is drop down and then flatline for a while. My personal favorite, I heard an economist actually refer to this as the reverse Nike swoosh economy. So take the Nike swoosh and rotate it 180 degrees. Net of it all, a massive plummet followed by an uptick, and then total confusion about what happens after that. So nobody has any idea. So we just know it went down and went back up, and now we're all confused. But what you'll see is there's a V-shaped increase in jobs. It's happening even in health services. I say V-shaped increase. If you like the reverse check mark, go with it. Kind of does that thing as well. You'll notice that healthcare actually added 312,000 jobs during the most recent job survey. To be clear, that is mostly rehiring in dental offices. Of the 312,000 healthcare services added jobs, 244,000 of those were new jobs or rehires coming from the dental area. In a quick recovery, this actually makes the assumption that daily case counts slow in developed countries by the end of June. The fact that this is not going to happen is what scared the market yesterday and is actually continuing it today. And actually it started at the beginning of the week. The week didn't start terribly well. It was kind of mixed, some areas down and up, and then it's just tanking towards the end of the week. A delayed recovery, this is the more realistic scenario where we actually see daily case counts growing worldwide through the end of summer. There are still some level of quarantines and travel restrictions. Testing capacity gets up to the point where people who need it, at least in the developed world, can get it. We start seeing increased testing capacity in the developing world. This actually assumes 2 quarters. The impact will be 2 quarters of overall economic decrease, 2 quarters of economic increase. We'll get back to where we were at the start of 2020, kind of towards the first quarter of 2021. Prolonged contraction, this says we either don't hit our peak of cases worldwide until late in 2020, or, not to scare you off because I think a lot of you are predicting this, or it comes in waves. As quarantines are enacted, they are lifted, and then they have to be reenacted. This is essentially the economic, not quite worst case scenario. Worst case scenario will be a structural correction, but this is close to a worst case scenario. But it's not long term. What it results in, if this actually occurs, is you're going to see a decrease through roughly the end, or the next 2 quarters. Then you're going to see a bottom out for about 2 quarters, and then you're going to see a slow rise. It takes probably 4 quarters or more. If this is the situation that happens, we don't get back to where we are now until sometime in 2020. So what do we have to do? We have to plan for it. I'm a big believer in David Allen is getting things done methodology. David Allen in GTD stresses always knowing what your next physical action is. To be clear, waiting is not a physical action. Hoping is not a strategy. I told you at the beginning of this session that I wanted you and your department to be the most valuable, the most needed, most critical area of your company. And to do that, you need information. We will not have people spending at their normal levels until there is a lasting solution to this pandemic. According to HBR, people are going to hold on to their money until they are sure that they can be safe again, because they're not sure what the economic impact is going to be. They're not sure about what their own personal medical spending is going to look like. And keep in mind, 70% of gross domestic product is consumer spending. So what we have to do is we have to scenario plan. When in doubt, at least plan for those 3 I just told you. Plan for the quick recovery, the delayed recovery, and the prolonged contraction. If you don't have time, don't bother planning for the quick recovery because I don't think it's going to happen. My general advice when doing scenario planning, plan for the 2 to 5 scenarios that are most likely to occur. Take those 2 to 5 scenarios, plan for the top 5 KPIs that drive 98% of your business. Then use those top 5 KPIs to derive that good financial forecast. Once you have those new scenarios planned, take your forecasts, share them with the rest of the organization. As a group, come up with an action plan. I was talking to one of our speakers later, and he made the comment, he's like, well, what if we do all the plans and they're all bad? It's like, then you definitely need to start communicating those right now, because you need to take action now while you still have liquidity. And if your board, if your trustees still think, yep, it's going to be fine, you better show them all those scenarios and say, no, it's not. And if we keep going on the path we were headed down, we are going to go bankrupt. We know a recession is going to occur, so we have to do scenario modeling. We have to understand for each of those scenarios, what are the constraints? When am I going to have my revenue, my expenses, my balance sheet, my cash flow squeezed? Because I need to find out when I'm going to run out of money if I don't take action. And then I have to make sure that I take action on those models. So what type of recession are we planning? Can we use the EPM to plan for it? My personal belief, it's going to be a V-shaped recession, but we don't know how long it's going to be. Harvard Business Review actually said at the start of March, plan for multiple scenarios. Don't plan on just one because you're going to be wrong. So once you do those three main scenarios, then plan for the alternate kind of edge cases. Then take each one of those scenarios and start coming up with your mitigation strategy, how you'll deal with each one. Because we need to go take an action. Many of you already visited IFN, Interrel Finance News. We're trying to post out there all the relevant news stories for the economy, for our business. If you haven't, please go out to interrel.com/updates and bookmark it today. This isn't a site you have to register for or you have to pay for. That's what it looks like on a mobile device. If you do list your email, all that happens is each day it sends you the top 3 voted stories from the day before. If there were any news stories in the financial world. Here's a good note. We're all coming together. We are even seeing people coming out of retirement. We're seeing people travel to other areas. One of my heartwarming moments was when they filled an entire plane full of doctors, nurses, mid-level practitioners from Dallas, and American Airlines flew a flight up to New York just to help people volunteer and give their time. We can't assume this is a one-off. We have to assume this is a new way of life. I was listening to somebody in the healthcare field, and they said the other day, and it was taken out of context, but I'm going to repeat it because I understand what he was trying to say. Coronavirus is a good thing for helping us understand the impact of a pandemic before it gets worse. And what he meant by that was coronavirus, it doesn't have the mortality rates. Think about what had happened if SARS had happened on this scale. We'd be seeing people between 10 and 60%. And we didn't have it figured out. We didn't know how to get people their PPEs. We didn't know how to get testing up to the levels. We didn't know if people would actually shelter in place if we told them to. This is essentially a starter epidemic. So we have to understand that after the COVID crisis ends, there are going to be 2 categories of companies in healthcare and beyond. The ones that don't do anything and hope this just doesn't happen again, and the ones who make investments in their futures. You as healthcare providers, you as healthcare professionals understand this is a starter epidemic. We have to have all these plans and we have to have them ready at hand because it is going to happen again. So we need to figure out how to get out of the one that we're in, and then we need to have all those scenarios that we obviously were not prepared for to deal with in the future. How do we do this? We survive together, we thrive together, but we have to keep communicating. Social distancing doesn't mean we stop communicating. I actually prefer the term physical distancing. My advice, go talk to somebody else today in your organization. Can't figure out something to talk about something you just learned. Hopefully you learned at least 3 things over the last 45 minutes. You could talk about scenario planning, for instance. You could do it over Zoom or GoToMeeting, WebEx, FaceTime, Facebook Messenger, Microsoft Teams, Google Hangouts, Skype, or one of these newfangled phone contraptions that apparently makes things called phone calls. However you choose to do it, commit to talking to someone today. Go make yourself important. I'm broadcasting today from the great state of Texas. We're trying to keep up our spirits down here while we do see a coronavirus outbreak. I want to give you a bit of Texan hand washing advice. Wash your hands like you just got done slicing jalapenos for a bunch of nachos, and you need to take your contacts out, y'all. I added at the last minute something that normally I charge for. And by the way, this does not apply to all industries. So we do have some people on from other industries. So if you want it, you have to pay full price. I apologize. I'm doing this as a pro bono thing. So we started at the beginning of March doing a half day, basically, how will you respond to the financial impacts of COVID-19? And think of this as not a full-blown strategic assessment like my strategic assessment team does, where you evaluate everything related to enterprise performance management. This is very targeted to what can you do in the next 60 to 90 days. That's why we're doing the whole thing in 4 hours. And My team comes in and we'll help you figure out what scenarios you should be planning for, how can you quickly do scenario planning, what tools you have access to using whatever you currently have. How can we make sure we communicate that information? How can we make sure we're doing modeling and real-time analytics? We'll work with you over the course of 4 hours, and by the end of the 4 hours, we'll give you some idea of what that action plan looks like in a roadmap. The big change, I'm doing it for free. This is a one-time offer, and if I get too many people come in, I might have to slot you. So I'm calling this first come, first served to the healthcare provider world. My personal email, because I'm the one that came up with this idea, it's the power of being a CEO, I could just declare things like this. Go ahead and send me a personal email, eroske, E-R-O-S-K-E, @interrel.com, I-N-T-R-R-E-L.com. So eroske at interrel.com. Shoot me a personal email saying you'd like us just to hop on the phone with you for half a day. I'll hop on, I'll give you some ideas. Me, Joe Altman, the rest of our vision team will hop on, we'll help you move forward. So that's my personal gift to you all, because I believe that our safety, our health, our future is in your hands. And I want to make sure that I do everything I possibly can to help out. And I can't save lives, but you can. So I can help you save lives. We have a lot of sessions coming up today. I want to say thank you in advance to all of our speakers. We have people from across the board. Bill Mal is Director of Finance Systems and Analytics from Children's Hospital of Colorado. They're a couple $billion-dollar health system out of Colorado. He, along with Tracy McMullen from Interrel, will be talking about everything they're doing right now at Children's Hospital of Colorado. We have one of my favorite healthcare experts from Oracle. She's going to be coming and talking about how we can connect and improve our clinical systems. We have Tracy coming in to talk about doing cost management and profitability, how we can understand, how we can get a good idea of our costs by treatment, by procedure, by services. We have a panel at 2:30 today where we're going to talk about what is the impact on the industry, and we have a lot of our speakers coming in today. I see a lot of people on today's call. If you'd like to be a part of that panel, go ahead and shoot me over an email, eroske@interrel.com. I would love if you are in the provider space and you're willing to hop on our panel. I'd love it. So right now we already have volunteers from Baylor, CHC, University of Miami, which is great. We're going to be talking about real-time analytics and how that helps with Opal at 3:30. And then at 4:15 Central, we are bringing everybody back together just to kind of wrap up the day. And then we're hopping into a happy hour. So you can have actual opportunities to network, bring a tasty beverage. It makes a great way to end the week. So I know this was a lot of information, and I hope that you've learned at least 3 things today about the economy, but more specifically what it means for healthcare. My name is Edward Roske. As I said before, if you have any questions, please, please, please email me personally. This is a subject near and dear to my heart, eroske@interrel.com. I want to say thank you for attending for at least a portion of today. If we understand if you have work, please make sure you hop back on at any chance you get. We're doing this as a benefit to you all. Thank you, everybody. I hope you have a great rest of your conference today. Oh, I will say one thing as Joe is bringing up the poll. We're doing various polls kind of between